I'm Beth Griffin. I'm the Global Business Leader for MasterCard for the healthcare and insurance sector. And I'm here to interview Brian Giunta from FIS. So Brian, I'd like to talk with you a little bit about payment innovations and what you guys are doing in that space. What do you see happening?
So in our space in healthcare, we see a lot of change and therefore opportunity for us to take advantage of. We're looking to drive a lot of activity to our new mobile platforms. And we see tremendous upside relative to HRAs, HSAs, wellness, and other similar programs that are mostly driven by our prepaid.
How do you see things, how do you see the market accepting some of the mobile opportunities?
So I think there's a key driver here with the user or the patient experience. And so, as we can simplify what they have to do to basically support their healthcare payments, I think mobile is going to be key. Also providing, the capabilities for them to handle various payment streams will be very important.
What do you see some of the challenges in the healthcare market in terms of implementing mobile?
Yeah, well, the big challenge we have is around the providers. The actual infrastructure for them to support mobile payments. It's not there yet. So, our hope and desire and expectation is that over time that infrastructure will be made available and they will adopt it, and then our mobile payments will be very effective at those locations.
So are you thinking about, what are some of the things that you're thinking about actually implementing in terms of capabilities for patients or for providers in terms of mobile?
Yeah, so at this point we're just really focusing on building a mobile brand out there, really on behalf of our clients, so that we can begin to have mobile access to accounts, balances, providers, pay to provider capabilities. So that's really our first step, and then as we move forward to some of the mobile capture that we may be able to take advantage of, and then on ultimately to initiating payments through the mobile device.
Awesome. It's exciting.
It is. It's very exciting.
Yeah. So tell me a little bit more about some of the other emerging payments things you see happening in the market today.
Yeah. So in healthcare, wellness has really been kind of the talk. And so we're doing our best to support wellness programs, rewards programs. So for example, we're working with a large employer, and they're offering a rewards card. So a employee goes out and they fill out a health risk assessment. We're going to issue them a prepaid card that can be used for other healthcare related expenses. And then, over time, there are other incentives that employer is going to introduce. So, for example, one of the things that they've just introduced is for diabetics, where you go through a certain treatment program, and each step along the way, there's a reward provided, and it's provided on the card. And those individuals can take that and again spend on healthcare expenses.
Awesome.
And we've seen very good adoption of the wellness programs, and we're excited to be a part of it and think that it's an exciting product. It's also really one of the things that's going to drive innovations in healthcare.
Are you seeing with the card that some of your consumer-directed plans are actually incorporating a wellness purse on the card?
Yep.
Or are you seeing that wellness card being separate?
So we see, really the multi-purse card as being a very, very user-friendly product, because you can throw on a number of different purses. We have technology that handles that very seamlessly for the consumer, so that on a single card you could have your HSA, you could have a wellness purse, you could have a reimbursement purse, and all of those purses really work well together.
Right.
So it's very important that we have this opportunity, with the prepaid technology to drive consumers to a single card for really all of their healthcare related payment activities.
Tell me a little bit about the actual wellness card itself and some of the characteristics that you're seeing in terms of brand and in terms of functionality, and how that's really morphed over time as you guys have experienced, gotten more experience with the space.
Well, what we really are seeing is the card is attractive to the consumer. So in the past, we've seen voucher programs that are part of the rewards program, and the adoption wasn't all that great. The card really provides convenience, and when we put that wellness purse on the card, and people use the wellness purse, they see value in the simplicity of the card. Everyone knows how to use their credit card, debit card, prepaid card.
Right.
And so, voucher systems, that type of product in the past, was met with resistance, if you will. Now, people are adopting the prepaid product much more readily than they are other types of rewards vehicles.
Yeah. Are you seeing that employers are really interested in adopting the card from an ROI perspective as well? And secondly, are they interested in restricting the use of the card to particular transactions because they're focused on healthy behavior?
Yeah, it's very interesting, and I think studies have shown that an open cash purse, if you will, drives significant, probably the most behavior change. But employers are reticent to kind of give out that full unfettered access to money when it relates to healthcare.
Right.
And so we've seen that a lot of employers are driving a restricted use product, so that people are not only are they being rewarded for healthy behaviors, but then they're using those rewards to further their healthy behaviors. And we see that being kind of the key growth area right now. And that may change over time, and we can handle either, but we've seen it really driven to that restricted purse with the employer.
Awesome. Well, congratulations on all the growth you guys have had in that space.
Thank you.
So tell me a little bit about I'm going to change gears a little bit.
Yeah.
I want to hear a little bit about healthcare reform and what you see as the impact and what kind of changes you guys are making to leverage card and evolve in that space.
So we see the exchanges probably being the biggest change to how we're going to be managing through the healthcare reform area. We see they're undefined at this point. Where the market is ultimately going to go is a bit of an unknown. But we are making sure that we're in touch with what's going on with employers, with plan sponsors, making sure that we're ready to take advantage of the change that comes in. With any change, there can be tremendous opportunity, and we see that. And so, our goal is to be there, be ready as the market begins to adopt various technologies and payment devices. And
well, we see, the market, we are expecting, given some of the recent studies, that consumer-directed healthcare, HSA, FSA, HRA accounts are expected to grow to about $52 billion by 2017. But clearly, the entire healthcare space, it's estimated about $2.6 trillion today. So where do you guys see some other payment activity in the payer-to-provider space or patient-to-provider space?
Yeah, so one of the things that we're working on is really the pay-to-provider, building out a network that facilitates those payments. The providers have a difficult job themselves, and they're just starting to build their infrastructures, as mandated as by healthcare reform, to make everything electronic, make it, and then when we talk about payments and supporting payments, that actually facilitates a lot of what we can do. So we've been out there working with providers, working with our networks to help work with providers to drive improvements in that payment chain.
Thanks, Brian. I really appreciate all your time today.
Great.
Giving us some great insights into what's happening in emerging payments and innovation.
Great.
Appreciate
Thank
it.